pleasure to be here. It's always wonderful to meet Judy and collaborate with you. And I guess this is, at least my 4th time now in Wales. All visits somehow they're related to KiVa issues. So it's wonderful to be here again in this seminar. Thank you for inviting me. And today I want to talk a little bit about the sustainability of the implementation of the KiVa program, because in Finland, after the big randomized control trial that we did, we launched the program nationwide since 2009, and of course that's been a long way to go. And I would like to say something about how the schools have sustained their implementation, what has happened to bullying and victimization in our country, what we have tried to do to support high quality implementation of the program, and what kind of research we have been doing on these topics. So some glimpses of these issues related to the sustainability, and I will also give some examples from other countries, because KiVa is actually now implemented in more than 20 countries outside of Finland. I think 23 might be the right number at the moment, Kazakhstan being the latest one to join. So we all probably here know and we agree that bullying is a really serious global concern. It's a human rights violation, but it's also a very significant public health issue because of the consequences that it might have on the physical and mental health of those who are victimized. There is between country variation, but we know that something between 5 to up to 40% of school-aged children feel that they are repeatedly victimized by their peers at school. And we know that it can have serious short-term but also some serious long-term consequences in the case of some individuals. So it really causes enormous human suffering and of course also high costs for the societies. How it started with KiVa in Finland, there was a lot of attention to bullying problems in the very beginning of 1990s. And as very often, this kind of attention and awareness follows from some really tragic incident. And actually in Finland, the very first shooting in school happened in 1989. I think that was something that really prompted this discussion, because the middle school student doing this told that he had been victimized severely for many, many years. And in the beginning of 1990s, when I was just starting to do my master thesis in the university, there was a lot of discussion in Finland about school bullying and what to do about it. This led to some changes in legislation such that the schools were mandated to develop an anti-bullying policy or action plan. They had to have some kind of policy in place. And the municipalities, but in the end of the day, the schools that had to develop such plans. So there was really this legal responsibility, legal duty to do something about it, to prevent bullying, to intervene in bullying. But the schools were not so sure what would be the best thing to do, how they should approach this issue. And actually, as we can see in this figure, which is from the school health promotion study, that was at that time only done in middle schools, but we can see that the percentage of middle school students in Finland who reported they are bullied weekly or more often, it was not decreasing after these legislative changes. In contrast, it was slightly increasing over the years. So it seemed like it was not enough to mandate schools to do something about it. So in 2006, the Finnish government decided that bullying prevention should be prioritized, and my group was mandated to develop a comprehensive bullying prevention program that could be widely used in schools in Finland. And this is how the development of KiVa started. And now it's widely implemented in Finland, but also, as I mentioned, in many other countries, and actually UK has been one of the first, and Wales, of course, is where it all began here in 2012, as Judy mentioned. The research background of KiVa, I want to say just something about it. I did my master thesis because, as I told you, I was just looking for a topic for master thesis when the big discussion in Finland started. So I had already done my master thesis on bullying, and then I continued this work in my PhD work. And this is my first published study on the topic, where I was looking at bullying as a group process, meaning that I was interested in what the other students do when they witness bullying, how they respond, and what kind of consequences their responses to these bullying incidents might have. And I call these different response tendencies participant roles of the students. And the key was that even though most kids, school-aged children and adolescents, when you ask them about their attitudes related to bullying, they typically agree that it's wrong and they don't want it to happen in their school. And if you ask them, you know, what are the things they dislike at school, very many say that bullying. They really have clearly attitudes that are against bullying. But when they are together with other peers in the group, they, despite of these attitudes, they easily behave in ways by which they may maintain the bullying behavior. They may reinforce and reward the bullies for their behavior. They may be laughing, you know, standing around, assisting the bully, going along in these mean actions, and so on. Or they may be just standing by, but not doing anything to help. And very few actually support or defend their victimized peers. And we know today very well that the responses of bystanders really matter, and we have studied that a lot. Many other groups have studied that, and we have still ongoing projects, like Lydia Laninhavainen in my group now has a new very cool project where she is looking at how defending those who are victimized, how that affects the mood and the well-being of the victims on a daily basis, you know. And she's doing a daily diary study on that. We also know that the responses of peer bystanders matter for classroom levels of bullying. So bullying is happening much more frequently in classrooms where classmates tend to reinforce bullying behavior and laugh when someone is being bullied and so on. Whereas in classrooms where students tend to help the vulnerable peers, bullying is much less frequent. But importantly, the effects of individual risk factors for bullying and victimization also depend on the classroom context. And I show you two examples of this. Here we can see the association between social anxiety and victimization. Social anxiety at the x-axis and victimization at the y-axis. And this association varies in different classrooms. So in some classrooms the association is stronger. So socially anxious children are more likely to be victimized. And in what kind of classrooms that is? That is in classrooms where the level of reinforcing the bully's behavior by the classmates is high. Whereas in classrooms where there is very low reinforcing of the bullying behavior, the association between social anxiety and victimization is almost zero. So this individual risk factor, social anxiety, which on average tends to increase the risk for victimization. It doesn't lead to victimization in all kinds of contexts. It really depends on the classroom norms and especially on the bystander responses. This is another example. My Chinese PhD student Pan Bin did this study about the association between social dominance goals and bullying behavior. And what he found was that the association, and this was a longitudinal study, so the association between social dominance goals, which is a known risk factor for bullying behavior. Some people who want to dominate have the wish to make others, you know, do what they want and want to dominate and have power. They are more likely on average to bully their peers. However, also this association varies between classroom contexts. So the association between social dominance goals and bullying behavior is strong in classrooms where there is very little defending behavior in the classroom. Whereas in classrooms where there is a lot of defending behavior, the association between dominance goals and bullying behavior is different. So there are some individual risk factors for victimization and for bullying, but whether these risks realize depends on the classroom context. So that's why it's really important to affect the bystander responses, and that's one of the key elements in the KiVa program. We have to encourage and empower students to respond constructively so that they don't go along with peer pressure, they don't join in bullying, but they really behave in ways that are likely to lessen the bullying rather than fueling it. And that's why we need universal actions targeted at all students. But we also need some indicated actions taken when a case of bullying comes to attention, because we can't, even though prevention is really important, it's unrealistic to think that we can prevent all bullying from happening. And that's why we need to have evidence-based procedures also in order to tackle the cases of bullying that happen. We need to help the victimized children, we need to make them believe that they are understood and helped by the adults, and we need to stop the behavior of those who bully others. And towards this end, we develop different materials in KiVa. I won't go into them in detail, just showing some examples. Here you can see the overall elements in the KiVa program, and to provide some examples, we want to induce empathy towards those who are victimized. This happens in different ways. We have the emotion cards that are used with the young kids to think about different situations, including situations where someone's being bullied, how that might feel, what emotions that might raise, like sadness, shame, anger, etc. We have fictional stories of children and their school days, and in our online game we also have elements that attempt to raise the empathy for those who are victimized. We want to affect the classroom norms, and one way to do this is to make the private attitudes visible in the group. As I mentioned, most young people have attitudes that are really clearly against bullying, but they don't express these attitudes to others. They don't say to others that this is what they actually think. And that's why we have some low threshold activities to make your attitudes public, to show them, to express them to others, so that we can see in the group that actually we seem to agree that we don't like bullying and we want to do something about it. We also want to provide safe strategies to support those who are victimized, different brainstorming activities about situations and what we could do, how we could do it without taking a big social risk ourselves. How could we communicate our support to peers who are left alone or who are victimized. And also, again, in the online game, the students can try out and practice different ways of responding in order to improve the self-efficacy to defend. We try to involve parents. We have newsletter to parents, we have parents' guide for parents to read, and we have different materials for schools. And also to parents, our message is that even though your child is not bullying others, even if your child is not bullied themselves, talk about bullying with your child, because most likely they witness bullying or they have witnessed bullying, and it's good to have the same message at home, you know, and think together how it might feel and how your child could at least resist the pressure to join in and respond more positively. Indicated actions, there are KiVa teams, and we provide KiVa teams with evidence-based guidelines, how you could approach students who have bullied others, how to address this situation with them, and so on. And monitoring, we provide school-based feedback for each school. This is just an example of the feedback sheet where the schools can see their own development, the average changes taking place in the KiVa schools in country, prevalence of bullying in different grade levels, but we also ask about many positive things, about school climate, about having friends, about nice things, etc. Not only about bullying and these negative issues, but the key is that each school gets their own school-based feedback, and we also provide some guidelines how you could then examine this feedback together with the students and discuss it and so on. It was a long time ago that KiVa was developed, and of course we have tried to do continuous development during the years as well, but also a lot of research. So I could pretty safely say that KiVa has been studied more than any other bullying prevention program anywhere in the world. And there is research done mostly in Finland, but increasingly in other countries. So there are studies that have been published from several countries, and I know that there is a lot of data collected and studies that are on the pipeline. So that's really, really great. And overall, it looks like implementing KiVa leads to reductions in victimization and bullying behavior when we compare this development to schools where KiVa is not yet implemented. In some countries, we don't get or let's say that in all countries the effects are equal, and it's something to think about why the effects might vary from one country to another. Is it implementation? Is it the culture? Is it the level of teacher education, etc. This is an example of the very first study, phase 1 of our RCT, where we only looked at grades 4 to 6. That means students between 10 and 12 years of age. And here you can see 9 different forms of being victimized that we studied. And all these bars are on the negative side, below 0, meaning that all 9 forms were decreasing in comparison to control schools, where KiVa was not implemented, including cyberbullying, by the way. And we have reported many other positive effects that you can see here, and you can see references to the studies. And there are more. We are still some people are still today working with the old data that was collected back then, and it's getting maybe a little bit outdated, but there are still interesting things that we can look at there. So, for instance, the current study was published 2021, looking at the changes in the empathy levels of students in KiVa schools. We also have found some effects on teachers, not only in how teachers evaluate their own competence to tackle bullying, but also in what students say about their teachers' attitudes and their teachers' ability to reduce bullying. And this is of course nice, that the students in KiVa schools started to perceive their teachers as even being more strongly against bullying and being better able to stop bullying from happening. And this is the same figure that I showed you before, but just now complemented with data after 2009, when KiVa was launched nationwide in Finland. So finally this curve that was a slight increase in the prevalence of middle school students victimized, and finally it turned into a decrease. And of course we would like to think that KiVa had something to do with it. Now we didn't have control schools anymore, because in 2009 and the years right after, it was more than 90% of Finnish schools that took up the program. So unlike during the first trial, since then we haven't had control schools, but we keep on collecting data in the schools that implement KiVa, and we study both implementation and the outcomes. This graph then shows, it's also, the red line is from school health promotion study, which I already mentioned. So it's done by National Center for Health and Welfare that is doing this school health promotion study. It's a very huge study in Finland, and it has asked about bullying and victimization, I think, since 1998 or something like that. And you can see that in Finland, since 2009, the prevalence, if the prevalence of students who reported they are victimized went down slightly, there is a really huge drop in the students who say that they are involved in bullying others weekly or more often. This is really a huge dramatic change. So the red line is the school health promotion study, and the yellow line is from our KiVa survey. And the KiVa schools are also included in the red line, so these are a little bit overlapping, and both show a clear decrease in the prevalence of students in middle school who have bullied others. But I wanted to make a surprise element, and that's why I don't show 2023 here, because unfortunately what happened in our survey last year was again an increase in these prevalences, both at the national level survey and in our KiVa survey. So it's really something that happened, and we don't completely understand what this post-COVID increase means, but I have heard from some colleagues that something similar has been observed also in other countries. So this is, of course, unfortunate. That was middle schools. I just show you school health promotion study was originally only done in middle schools, but since 2017 they started doing it also in primary school grades 4 to 5, meaning 10 to 11-year-old children. And here you can see the prevalence of students who are bullied weekly in primary grades, in school health promotion study, and then in KiVa schools. And here you can see that this post-COVID increase is there as well, but not in KiVa schools. And also you can see here that the difference between the national data and KiVa schools, it's larger, it's much clearer, which goes hand in hand with what we have found before, that KiVa seems to have more an effect in primary school. And this is also primary school, but now students who are bullying others weekly. And school health promotion study, we see a recent increase. In KiVa schools, the prevalence is very low and remains stable. But still, there is something to understand in this most recent trend. But then I want to talk a little bit about implementation, because, as I say, it's been a long way since 2009 in Finland. That also in many other countries, KiVa has now been implemented for many, many years. And I often tell the teachers when I train them that it's like a Hoover. Even if it's the award-winning, test-winning Hoover that you buy into your home, it doesn't clean your house unless you switch it on and someone has to do the work and start using it. And also it's a nice analog, because it's also the case that it's not enough that you use it once and then you think that, okay, now it's done, but you have to do it systematically, regularly, in order to keep the dust away. So, of course, implementation is the real challenge, and this is something that we have found in Finland as well during the years. Also because schools always tend to want something new. Even though, on the other hand, they are kind of saying that there are always new approaches coming and new demands, but still in schools, and also probably even more maybe on the political level, there is this need to introduce something new as a solution to an old problem. We have tried to support the implementation of the program in KiVa schools. We send in newsletters regularly. We organize KiVa days. Judy has visited our KiVa days at least twice, I think, in Turku. Actually, we haven't done it after COVID, so COVID was something that finished many things. But just before COVID, actually, what we did this KiVa on the road tour. And that was kind of already an alternative to KiVa days, because KiVa days we always organized in Turku, and the personnel from KiVa schools in all Finland came to Turku for this nice seminar. But some of them say that it's so expensive, it takes a lot of time to travel, etc. So we decided to try this kind of KiVa on the road, and that was really great, and I think we need to do it again soon. So there was always one person from our group at the university and one teacher from a KiVa school, and they were training as a pair. And we had this training all over Finland, so instead of inviting them to Turku, we went around, because Finland is very small if you look at the number of people living there, but it's quite big actually if you look at its size. So instead of making them come to us, we went to them, and that was a great success. And then we also every year we choose a KiVa School of the Year that has been doing very well in implementation or in reducing victimization and so on. And we train the schools in Finland but also internationally. Just last week we had another training for international trainers in Turku. 24 new KiVa trainers got their certificate, and then we have booster trainings for them regularly. So we are trying in many ways to keep the schools on board. We have done some research where we have tried to understand the implementation, what happens to implementation during the years, and what could we do about it? How could we support the schools even better? And I just tell you some examples of studies that we have done. One was the study by Sainio and colleagues that we published some years ago about sustainability of KiVa, and we looked from year 0, which is 2009, when the implementation started, and Mia was doing different latent profiles of schools, action trajectories, looking at the different schools, how they were doing with implementation, and we identified different groups. And you can see that about 42% of all schools that started to implement KiVa in 2009, which is year 0, continued with good level of implementation from one year to another. But then there were different profiles. Some schools dropped off very soon after the first year, some dropped off after 3 years, so that seemed to be one critical moment. Some didn't start so enthusiastically as others, but then they were, we call them awakened, so they woke up at some point and started doing better in implementation. And we wanted to understand who are these schools that are persistently implementing KiVa at high level. A bit surprisingly, bigger schools where the number of students was larger, implementation was more sustainable. Good coordination, this is not surprising, and how well they, in the very beginning, informed the whole community, in the school and also at home. Also, initial level of implementation predicted sustainability, so those who started very well and did more during the first 3 years, they were more likely to sustain. But also schools where the initial level of bullying problems was low. So this is a little bit paradoxical, because we would like those schools to implement it better where the problems are big, but actually the schools where the initial levels were low, they were implementing it better. And probably it means that those schools have already done a lot before. They were committed to anti-bullying, and they really prioritized students' peer relations and their well-being, and that's why they also sustained their implementation. Another interesting example is about indicated actions. So we continue collecting data in KiVa schools, and every spring we ask the KiVa teams in their survey which method you have used when addressing bullying cases. And we have different response options. You know, in KiVa there is a confronting approach, there is a non-confronting approach, and schools could also say that they use either one of the two, depending on the case or on the team member. And then some schools say they use their own model, their own adaptation, which was none of these two, and there were some schools where KiVa teams say they don't know which approach they have been using. And as years went by, actually schools were moving from evidence-based approaches to using their own solutions. And even the amount of schools who said they are not sure what they did was slightly increasing. Probably because there was more and more time from the initial training and there is stuff turned over, etc. We also ask in the same survey every spring from KiVa teams, how effective you think your indicated actions have been in solving the bullying problems. And we asked the students who had been victimized and whose case was addressed by the KiVa team, was the KiVa team's intervention helpful? And what do we find? Both KiVa teams and students found the indicated actions most effective in schools where KiVa teams told that they had followed the evidence-based guidelines. And the worst results were in schools where the KiVa teams said they don't know how they addressed the bullying cases. So, of course, this is not to say that the confronting and non-confronting approach are absolutely the best ones and schools shouldn't do anything else. Maybe it's also an indication of their overall commitment to the program and how they follow it, or etc. But maybe also that it's very good to have a clear idea and guideline and clear procedure to follow. And of course, better when there is evidence that it also leads to good outcomes. What else have we found about factors that contribute to implementation? In this case, the dosage of KiVa, the amount of KiVa that is implemented. Anna-Mari Lahtola in one study reported that principal support for anti-bullying work was really a key factor. And she looked at both general principal support for the staff and principal support for anti-bullying work. And it was really specifically principal support for anti-bullying work. How much the principal communicated to the staff that this is our priority, this is important, I want to support you, I want to give you time and resources to do this well. Anne Haataja in her PhD also found that principal support was important. Teachers believed that the program can have positive effects and good lesson preparation were factors predicting a better dosage. In Delaware, there was a very nice study as well, where Julie Hubbard and colleagues, I think by the way, Julie Hubbard was in Wales also in the KiVa training 1 year before their study. They found in Delaware in the US that they looked at the dosage in which KiVa was implemented in schools. They found that teacher burnout was associated with lower dosage, so those teachers who were struggling with their workload implemented KiVa less, which makes sense. But also it was very clear that the higher the dosage implemented was, the more bullying and victimization were decreasing, the more empathy was increasing, etc. So we can see that dosage really, the level of implementation of KiVa really mattered for many different outcomes. Then the last example that is the most recent thing that we are now doing in Finland, and this is led by Sanna Herkama in my group. We wanted to see whether we can develop a mentoring model where we support KiVa schools in Finland in high-quality implementation of the program. And we wanted to see whether this kind of mentoring can really make a difference in the quality and quantity of implementation, and of course, whether this difference also shows in student reports of victimization and bullying. So Sanna and colleagues, they are currently in the middle of RCT. The mentoring has been done already. It was 1 year process where they visited the schools and provided them with this mentoring, and now the data has been collected, and they still will collect the last follow-up data this spring. But it was RCT, randomized control trial, 24 Finnish primary schools, and they are all KiVa schools. So half of them got the mentoring program, and half of them just continue with KiVa as usual. And it was the school year 22-23 where support was provided to the intervention schools, the IMPRES schools, and now soon the data will be ready, and the protocol for the study was published very recently. So far, implementation support offered to schools. Hypothesis, it will increase program fidelity and change the administrative barriers and facilitators for implementation, and then we will gain even larger reductions in self-reported bullying and victimization. This is what the implementation support looked like. There was first assessment and very detailed feedback, training for the whole school staff, and then mentoring sessions to staff members. And the first results are promising. I just heard from Sanna and Marie-Claire, who are working with this data, that they don't have a one-year follow-up yet, but they had the data that was collected before and right after the mentoring. And it really looks that something is happening. So this is nice, and we hope that we can learn a lot from this research project and these findings. So these are some examples of sustainment and the challenges that there are, and the ways that we have tried to tackle these challenges, and how we have tried to study these issues also. And I thank you for listening, and I'm of course very willing to answer questions or hear any